Yeah, I don't know if you're like me and, going through all the talks, and I was really wondering what's left for us and for our, close to last talk. My name is Rado Andrian. I'm a digital health consultant, and I basically help pharma, MedTech, health tech startups, and insurance company really embrace the digital health challenges. Also build the strategies, build programs, and build solutions. And I'm honored to host this conversation today with Innocent, Stan, and John. I'd like to just let you introduce yourself and take that angle of connecting the dots.
Thank you so much, everyone. Thank you so much, everyone, for the invitation to be here today. I'm very excited to be able to share some insight as it relates to connected devices and a hybrid healthcare model. My name is Innocent Clement. I am the CEO and founder of CIBA Health. CIBA Health is in the digital therapeutic space that is that is changing and innovating how we care for patients with chronic disease condition. I'm happy to be here.
Thanks very much, Rado. I'm Dr. Stan Shepherd, a physician in the UK. I'm also a faculty member of �၀𝐞𝐝 International, which is an international thought leadership group, and CEO and founder of a company called Instant Access Medical. We provide personal care records for citizens because we believe very strongly that the citizen should be the primary data owner and that we should all have our own health data on our mobile phones lifelong.
John.
Hello, my name is John Lodge. I am the Chief Executive at Hexy Time. We created the first professional time bank in the world around healthcare, and we support people to exchange skills and expertise to help each other to improve services. I also work in the UK NHS for an organisation called NHS England.
So we had a long conversation before just to prepare that session, and as I said, when I was going through the day and all the talks before, I was really thinking, well, actually, they've addressed the challenge of data, RPM and wearables, PMRs, telemedicine. So, today, if we could take something out of that always connected, and give it another angle. In 2020, Roland Berger made a publication, and they talked about the rise of platform. And the three of you represent three different flavors of platforms. Innocent, you're in what Roland Berger describes as horizontal platform, where you really look at the conditions. From your perspective, Stan, that's really on the vertical platform, where it's really, the information across health actors. And from your side, I'd say, John, that's where you stand out, because while the first two are more architecture platform, you're more on the exchange platform. So how do we supersede all those different, singletons to really fulfill this new model, this new value of a world connected? Who wants to give it a shot first?
Well, I'm happy to kick off, and I think what we all recognize is that healthcare is behind retail, finance, banking, travel, insurance, in terms of its digital transformation. If you ask yourself what are the benefits of digital transformation to those industries, it's lower costs, increased efficiency, and increased customer satisfaction, all of which we could well do with in healthcare. And those industries, to get those benefits of digital transformation, had to do three things. They had to move the whole industry from organization-centric thinking and systems to consumer-centric thinking and systems. And they had to enable consumers to interact directly with those industries themselves. And to do both those things, they had to create a longitudinal, lifelong record for each consumer. And I think that's where the always connected bit comes in. The always connected is the consumer always connected to the industry, or in our case, the healthcare system that they're part of. We heard on the earlier two sessions there talking about empowerment, talking about education, talking about self-care and self-management. We can't do any of those things unless we have the information, unless we have the data. And the always connected piece is to allow the consumer, certainly it's to allow healthcare professionals to share information and talk to each other. But I think we heard somebody say about patient centricity, so these are just words and it isn't happening. We'll make patient-centric when they hold their records. So when it's a citizen-held, citizen-owned data on your mobile phone.
Isn't that what you do, in a sense? Or
Yeah.
try to achieve?
I certainly agree with what Stan just shared today. I mean, it's, looking at healthcare today, healthcare is changing very rapidly. And, we also need to take into account, the patient, right? I mean, the key is always empower the patient. It has to be patient-centric. It has to be really accessible. So this very important, when you're building any platform, you're creating any solution in the healthcare space. A lot of times, we build solutions like this, it's not personalized, right? And the patient don't really have insight to the data. They don't know what the data is showing. But, now with technology, now we begin to build platforms that allows that sort of data sharing. Patients are able to see data in a structured way, they're able to see insight, right? And then tracking whatever, maybe A1C level, tracking their sleep and all of that. It's very important, very powerful as we continue to make decisions in the healthcare space. You would agree with me, COVID today has exposed us to how broken this healthcare system is today. Looking at, patients, most of them wouldn't want to even go to the hospital now, but with the connected devices now, that allow that opportunity for the patient to be able to really be part of their healthcare journey and be able to really empower them, to support them as they continue to make decisions as part of the process. And providers as well, the doctors, the nurses, the dietitian, the health coaches, are also able to look at that data real time and identify trends so that they can provide proactive approach to really supporting this patient and then really to support them as they continue in their healthcare journey, which is really, really what's one of the most advantages of using some of the connected devices, the wearables that we have today. But certainly, this data has to really be very structured. It has to be, provide some great insight for the patient to begin to make decisions. Because if not, then the patient will, and again, like one of the speakers mentioned today, a lot of times patients go into Google and start searching for, what's going on. But if it provides them that key insights, and it provides the providers that key insight, they proactively begin to make decisions to really see how they can better support this patient.
But again, that's still kind of technology, driven or technology oriented. You bring adoption through that technology, but isn't there a different twist on the engagement? I mean, John, your platform is not about the technology. How do you bring all the people in your platform, and how can you really build solutions where we've got patients in one hand?
So a couple of reflections. I think one is this concept of citizen, an empowered citizen that determines how and when they want to participate. So when we were designing the time bank, we wanted people to identify their own skills and expertise, independent of conventional labor markets, so they could participate how they want to and to bring their best self to improving health and care services. There's something about being connected all the time that has shown to us as well that the people who participate with our technology are increasingly turning their back on conventional power, command and control power structures. They're increasingly showing that they don't respect or need them when it really matters most. To give you some, a really simple example, when in my London street where I live, during the pandemic, I probably know, like a typical Londoner, I know my neighbour on my left and my right. I don't know anybody else on the road. But when people were isolating and in lockdown, we started to consolidate around things like WhatsApp groups. And suddenly I knew 60 people on my road. And and more importantly, I knew who the vulnerable individuals were on my road. And when the old vulnerable lady at the end of the road needed her prescription fetching or needed the shopping picking up, I could go and do that, and so could my neighbours. And there was this sense of not needing the council to do that, not needing the state to make those basic interventions. They were empowered as citizens to come together as community and help where they can. Now, I'm not an anarchist. There's clearly a position for state and governments in this. But what I'm saying is that there is power and potential beyond what I think we really understand at that community level when we empower citizens to understand their assets, own their problems, and come together on their own terms. And so, yeah, we're a tech company, but we're fundamentally about the community and the citizen, using the tech as a vehicle.
Yeah. So you mentioned empowerment, and I think we've heard it a lot today, but you're talking, ownership associated to that. And in our discussion, it comes back to the data, or to a certain model around the data. Innocent or Stan,
Right, to also ensure that who really owns the data. And I think the patient should really own the data. But even though right now what we have in terms of, the way it's structured, it's always either the organizations that own the data. But because when the patient owns the data, they feel more empowered because they feel like they're also part of that process. Because, looking at, let's say, managing maybe chronic disease condition today, right? How do you enforce, how do you provide that lifestyle modification behavior changes if, those patients or the users of these platforms don't really feel empowered, they don't really feel that they own this data? It becomes a challenge, right? So because your goal is always to see how you want to really improve the clinical outcomes for this, the patients or whoever is using your platform. So, once they get a sense of that, the ownership that they own the data, really, that also helps them to really begin to also, they feel empowered, right? Because they feel that this is really truly centered around me. This is truly personalized around me. And then would help them to continue to make some decisions or lifestyle modification or behavioral changes that will support, whatever they're interested in to manage their situation.
Stan?
You talk about a new model, Rado. One of the things that digitization does, it breaks the lock between data and its location. Much of the time you go to see a particular doctor because that doctor has your record, and maybe you like them, maybe you don't, and it's not easy to shop around. If citizens have their own lifelong personal care record and their own lifelong data in that, then having broken the link between data and location, you give the citizen a fantastic amount of power. We heard on the previous panel talking about paternalistic medicine, talking about we have to let go. We heard Professor 𝐿𝐴𝐻𝐿𝐴 talk about being humble. The digitization will inevitably break the lock between data and location. If the data is with the consumer, then that will be the driver for this change. It is never made, because the patient pops up everywhere and in different locations and seeing different specialists, it's never made sense for the data to be locked in all those different silos of all the different healthcare professionals you see. It's just that on paper, we've had no other way of doing it. It's not that it was the logical way, it's not it was the best way, it was the only way. Digitization will change that.
But then we're still talking about health data, and it's big, it's huge. We talked about the sensors, and if you start to put your wearable and your patch and this and that, how do you live with it? How do you manage it as an individual and say it's mine, but is it really yours? So in the systems we're building, how do we create that ownership, even if that data goes somewhere into a repository that belongs to a company? How do you transfer that power from the company? Today I've got Fitbit, I use it to go to the gym, is it really my data? Not necessarily because I'm not interested, I'm only interested in the fact that what Fitbit gives me is the value of I can manage my physical activity, and that's my VO2 max. So I really need that insight. But the raw data itself, it's okay if it's not mine. So where is that limit of really, hosting that data?
Yeah. I think we do it slowly over time. I mean, let's draw a parallel with finances. Nobody would say, I don't want a bank statement. I'm just trusting my bank manager to let me know if I'm in trouble or not. I want my own data. I'll manage my own finances. We educate children now on financial common sense and educate children about how to grow up in a financially dominated world. There was a time when that didn't happen. There was a time when the majority of the population didn't have a bank account. But because in medicine, we've always had this paternalistic approach, we haven't got to that point yet. But it has to happen, and it will happen. And it won't happen overnight, but we start with humble things. I know Innocent, I mean, you can talk about, your product and just simple parameters, blood pressure, blood glucose, how it's transformational, giving patients their own data directly in real time.
Yeah, absolutely. That's a very important point that you just shared here. I mean, similar to how we're doing it now with our current product at CIBA Health, really, because really for me and for us as a company, the most important thing is to really ensure that it's really truly personalized, truly patient-centric. It's really there to empower patients to really see how we can support them to make some lifestyle modification. So, there's a consent process, right? So you want to ensure that the patient is consenting. What are they consenting to? Are they consenting to the data? Let's say you're using a Freestyle Libre. Yeah, are you consenting to that data that it's going to be housed in Freestyle Libre in Abbott, or are you consenting to that data will be, yours, right? So at every given process, there has to be that consent process, right? To ensure that, we know where that data is going, you're consenting to allowing that data to move to whatever location that data is going. That's what's also missing. When every time they say, the data is there, or who truly owns it? The patient doesn't own it. But it's also important to get some insight for the patient, right? That would help them to really make some important decisions when they look at that. It's so powerful, right? For me, when I look at the trends of my, let's say, my glucose, blood glucose today, and I see where it's trending, with that, I'll be able to look back and say, okay, what can I change? What would I do differently that will really begin to see how I can really normalize my continuous blood glucose, right? So these are the things that we need to begin to look at. I mean, we have to really create policy framework. We have to be able to create legal framework that will really ensure that the data really it's for the patient that really own them. But again, it's a huge challenge. I don't see that happening pretty soon. But I mean, I think we're getting there. We begin to understand what we should do really to really have patients own this data.
So we're back to another. It was the first talk about regulations and GDPR. But if you just keep that on the side, just a little bit, and come back to one word you said, which is trust. Because there was one publication, I think it was in 2019, and we are all health tech companies here, and the report said that patients trust the clinic to keep the data, they trust the pharmacies to keep the data, they trust the third one was the GPs to keep the data, but they don't trust the health tech companies and they don't trust the government. So how do we modify that? How do we bring that trust? And that goes into your model as well, because you're generating data as well, and you're capturing data, you're capturing insights. How?
Yeah, of course, I've got a very different view on this because we don't capture patient data, so we have a very, very different risk profile to what you're talking about. But by way of our experience, what we found actually is that whenever it does come to data, and we have strict obligations around what we do with that, our most reliable, trustworthy, and best relationships are with small companies, because we can have a direct relationship. we know the supply chain, and we can develop trust. Very, very early on in our partnering procurement process, we quite deliberately excluded some large organizations for lack of trust. And when it came to data security, worked with a very, very small company in Cornwall, and certainly haven't regretted that decision. Another reflection on this conversation is that where possible, we do not collect the data. And that's where it's a very different dynamic around patient data, where more data helps you guys, more data creates risk for us. But we do go out of our way to collect data where it has social value. So particularly around like demographic data, for example. But as a rule of thumb, we only take data where absolutely necessary, and we demonstrate to our community and our users why we take it and what we do with it and what the output is. And we also, where our users have their own data, we make sure that they can do something meaningful with it. So it's not just data per se, it's understanding when that data is improving or getting worse, and that they're empowered to raise the flag, to call for help, to ask for action. So you need that sort of that knowledge with the data as well on that point. But we have a very different context to how we take and apply data to your patient-facing applications.
Yeah, I think the route. I don't think we mustn't underestimate the challenges and complexity here. But I think that sort of the North Star, the root of it is, number one, we have to enshrine the citizen as the primary owner of their data. It is their data. Absolutely. We don't always see it that way. We see it as the doctor's data or the hospital's data. It isn't. It's the patient's data. And secondly, data is shared, and commonly the one person it's not shared with is the patient. So we should share all the data with the patient. If you share it with the patient and they can see what their data is, and you're treating the citizen as the primary data owner, that then enables you to do everything with explicit consent, not implicit consent, which is the way the National Health Service works in the UK. You seek treatment, you must buy implicitly, you're giving me permission to use your data. For our model, the data consent is explicit, and it's not just yes or no, it's I consent for you to use my data for this purpose. I consent for you to use my data for that purpose. So that's number one, the citizen's primary data owner. Secondly, the data share with the citizen. Thirdly, it's all done with explicit consent. But you must then go further. As we heard, there's the blockchain conference going on alongside this one. One of the things that happens with data that upsets people at the moment is I agree to share my data with party A, but then party A shares it with party B and doesn't come back to me, doesn't get my consent for that. It's complicated if party B then sells it on to party C or party D, etc. But technologically, we can manage that. And we would suggest that if I agree to share my data with party A, if party A wants to share it with party B has to come back to me. And I have to agree for party A to share it to party B. If party B wants to share it with party C, they come back to me, and I agree with it as well.
Absolutely, I certainly support what Stan just said, because again, goes back to what you talked about trust, right? I mean, you said the patient trusts the doctors, hence why when the data is either owned by the hospital or the providers, they don't have a concern with that. But I think they do, but it's still all about that trust. It's still all about how is that data provided to this patient? Is it provided in a structured way? What sort of insight does the data provide, right? Because these are the things that would really be able to provide them some sort of either empowerment or provide them with, how they can begin to make some sort of lifestyle changes or behavioral modification given what they're getting. Because if the data is not structured, then it becomes a problem, and then that data becomes useless.
Oh, great. So we're running really on little over time. I think just one last note. What keeps you up at night? You're building, again, platforms. Or what keeps you up at night? We talked about the trust. We talked about the data. Just one word.
I think what keeps me up. what keeps me up at night is, really providing healthcare that is really holistic, healthcare that is accessible.
That keeps me up at night, that we're not moving fast enough.
And how we engage with staff that are exhausted and under-resourced and overworked in a radically different way that's not more of the same.
On this note, I'd like to thank you all. Thanks again for this time.
Thank you.